Halo, saya Ira. Hari ini saya bersama Dr Tan Kok Soon. Beliau adalah Medical Director dan Senior Cardiologist dari Orchard Heart Specialist.
Selamat pagi.
Selamat pagi. Okay. Dr Tan, today we want to talk to you about heart attack. We know that sometimes heart attack you don't really have symptoms. So, what actually causes heart attack?
You don't have a heart attack. It's a very dangerous and serious condition. And typically, all right, when we talk about heart attack, what happens is that you may be okay sitting down, enjoying life, and then suddenly something bad will happen. In other words, you have very bad chest pain, and you just ignore it. It may get worse, and in very, very serious condition, soon after that, you may drop dead. So that's why it's not a good thing to have a heart attack. And the reasons this is happening when you are having a heart attack is that one of your heart arteries, normally you have three heart arteries supplying the heart, usually one or a few of the blood heart arteries get blocked up suddenly. Okay, 1 minute it's not clogged up, and the next moment suddenly it's blocked up. Okay, and when that happens, that part of the heart that's supplied by that artery stop getting blood supply. Okay, when you don't get blood supply to the heart muscles, you start very quickly soon after start dying. It's kind of and as time goes by, the amount of muscles that's damaged get more and more. Okay, and when there's damage to the heart, when the heart muscles start dying, things can happen. Bad things can happen. The heart can react by kind of pumping irregularly and stop the heart and all that. Okay, but the trigger point of a heart attack is the heart arteries get blocked up suddenly. Yes.
If the heart is blocked, is it because of calcification?
No, not so much. The calcification is a different thing. Now the reason is that normally if you've got a normal healthy artery, it doesn't block up suddenly. Very rare. There are other issues, but if you have a healthy arteries, nothing usually would happen. People that get heart attack or are susceptible to heart attack are people that have disease or abnormal heart arteries to begin with.
Okay.
Primarily when you have cholesterol built up in your arteries, like to a certain extent moderately bad or severely bad, those are the people that are likely or susceptible to having the arteries block up suddenly, probably due to maybe inflammation around the blocked arteries. And when that happens, sometimes the arteries get damaged a tiny bit, and the blood going through gets irritated, and a fresh clot form on top of the blocked artery suddenly, blocking up the blood supply. Okay. So in other words, you do not get a heart attack if you are healthy. So generally young people usually don't get heart attack. It's usually more the middle-aged, the older people that already have blockages in the heart arteries that are susceptible to having this. Okay. Now, the calcium, the heart arteries is a test that we do when we do a CT scan. You see some calcium within the wall of the heart artery. Yeah. In other words, in a normal healthy heart artery, it's like they shouldn't be. It's like a water pipe. Okay. It's very flexible. Okay, and in the middle there's a big lumen or hole where the blood can go through. Now, but oftentimes in people that are susceptible to it, people with high cholesterol level, for instance, as you get older, the inner lining of the wall absorb the cholesterol, get damaged. The cholesterol stays within the wall of the artery, and because of that there's a bit of inflammation going on as the years goes by. And when that happens, some of the cells may die and get inflamed, and during that process, all those dead cells may deposit some calcium, which is bone essentially, into the wall of the artery. Within the way the cholesterol has collected and get deposited, there will be like specks of calcium, specks of like all these bones, which can be easily spotted on the CT scan.
Okay.
So usually when we talk about calcium in the heart arteries, it is really like a proxy. It's like an innocent byproduct of cholesterol build-up in the wall of the arteries. We keep talking about it because it's so easy to pick up on the CT scan. All right. So what we do with the calcium, like when we talk about calcium, is that when you have a high calcium score on your CT scan, it implies that you probably have very bad blockages on your heart arteries. Or you don't have high cholesterol, high calcium. It's very likely that you have minimal blockages in your heart arteries, okay? And the blockages per se is not due to the calcium. It's more to do with the cholesterol, all right? And the calcium is a byproduct of the damage, the cholesterol buildup within all this.
Okay, so the calcification is because of the cholesterol as well,
yes, okay.
not because of too much calcium in your...
No, and in fact, it's totally nothing to do with the calcium that you ingest through your mouth.
Oh, okay.
And a lot of our patients come with a high calcium score, and their vitamin D level may be very low. They may have osteoporosis and weak bones. And we will still encourage them to take calcium, because that calcium does not translate into calcium in the heart arteries. It's more the cholesterol level, the blood pressure, the smoking, or that will causes the cholesterol build-up and build-up of calcium in the arterial wall. So
usually if there's any blockage, then doctor will advise to do stenting or ring.
Yes.
Yeah. So is there any different type of stenting that you recommend?
Yeah. So when, as I mentioned earlier, the end point is that you do not want to suffer a heart attack.
Yes.
Yeah. Now, a lot of people, as they get older, they have narrowings on the heart arteries, and this can progress from maybe like 10% narrowing, then 5 years maybe 20%, and then 10 years later maybe 70 or 80%. And usually it's only the ones that have very, very serious blockages that we would worry, because these are the ones that will get into trouble. Usually rule of thumb is that if you've got a bad blockage of more than 70% in severity, then we have to probably take action, usually. And by taking action, there are one or two things we do, right? In addition to taking medicine, sometimes we would advise the patient to have a ring put in, or even go for bypass surgery. Now, when we talk about ring, putting in a stent or a ring, what we are doing is that if you've got an area that's like quite badly blocked, like 70% blocked, what we do is that we prepare that area. For instance, if you have like a part of the artery that's blocked up with chock full of cholesterol, and the narrowing is very bad and it's limiting the blood flow to the heart, what we can do is that we can stretch up the cholesterol build up and then put in a stent, all right? Okay. And the stent is delivered, like the way we do is I put it in with a balloon, and then you use the balloon to expand up the stent, and the stent stay put, and you take out the balloon. So eventually the stent would remain within the wall of the artery, all right? And all it does is to like open up the narrowing within the heart arteries.
Will it close back?
Now, the answer is no, all right? But like in all things in medicine, the stent is a foreign body. Yes. All right, and when you put it in, it may look very nice, but because it's a foreign body, some people can react by aggressively closing up the artery again. A very aggressive feeling, like people sometimes when you cut yourself, a very big scar, keloid. Yes. Some people react to a foreign body or some damage to very, very aggressive healing. So during the healing process, oftentimes it's so aggressive that you can clog up the narrowing in. But with the modern stents that we have, the chances of that happening is so high, like maybe 3-4% every time you put in the stent. Okay? So there's been a lot of development in stent technology in the last 20-30 years. So by now, all the stents that we have are really modern stents, and it kind of minimizes the risk of this clogging up again.
Okay, so if you already have a ring in your body, right, will the chance of getting a heart attack still the same, lesser, or?
Now, and the answer is it'll be less, but it depends, all right? So if you imagine you have put a stent into an area that you expand and all that, is a raw area. During the first 3 or 4 months, or 3 or 4 weeks, the body started by healing up and then forming like a cell or a layer within the wall and covering up the stent. During this period, there's a very high risk that if you don't take your medicine, that this can clog up because it's irritating the blood going through. So oftentimes after a stent, the doctor will really strongly advise you that you have to take 2 blood thinning medicine to protect yourself for at least the first 1 month. Okay? But after that, once it's completed healing up, the stent is actually inside the wall of the arteries. It has nothing to do with the blood supply. Okay. And when that happens and everything is okay, the chances of you having a heart attack, because this can clog up again, is not high. Okay, it will be like minimal. But having said that, you can still have a heart attack, because when we put in a stent, we only treat a very small area. Like for instance, you may have a blockage here, you may put in a stent here, and normally you've got blocked arteries, you have blockages everywhere. Some places will be more, some
because
places
it's not
will be
healthy in the first place.
Exactly, because it's a systemic thing, it's not a local thing, okay? And oftentimes some people can come back with a heart attack because another area, okay, which is 60-50%, and if you've not been taking your cholesterol medicine, that can act up and have a heart attack there. Yeah. So the answer is that when we put in a stent, the whole point is to reduce your risk of having a heart attack. But you still can have it because of all these other issues. So in other words, if you've got heart disease, you've got narrowing your heart.
Do treat early.
Yeah, do treat early. And also it's not you treat and everything is okay. It's a journey in a way. It's like treating something chronic, like treating like diabetes and high blood. You have to take medicine, you have to have checkup regularly. Because this is, to be honest, a progressive disease going forward. But usually after having a stent, you are safer than before from the risk of a heart attack.
Okay. Thank you so much, Dr. Tan.